Hello, my name is Jill Fox, and this is my poster presentation for Evolution of Professional Nursing. I apologize for my voice as I've been really sick this week, and I apologize for any coughs throughout my presentation. The book I read was Susan Riverby's Order to Care, The Dilemma of American Nursing, 1850 to 1945. Published in 1987. This book covers nursing from the 1850s to 1945 in several different areas. Riverby does a great job of covering nursing history over the course of 95 years. Reading this book helped with understanding our history to shape our identity and thinking of history as a pedagogy. Identifying truth of the past with evidence to give nursing a voice with history as evidence. It also provided context relevant for the present to help us look forward into the future of nursing using history as explanation. History as a pedagogy regards shaping identity and thinking. Nurses were considered to be respectable and loyal, following doctors' orders like a soldier, and that they should be disciplined as such. As students, they were as Riverby describes, as hospital machines, as they worked long 10-hour shifts. They were expected to attend lectures at the end of the day. They did not have structured learning as we have today, where an instructor has to be with you for many nursing tasks. Instead, the students actually worked and provided care. They made the hospitals money by having cheap pay for services, and the hospitals benefited off of their private duty. There was not a lot of unity in nursing then, making it hard to achieve any kind of professionalism when seeking rights and definition of practice. Today, things are different as we have structured learning environments where much of school is lectured with clinical time added in. Nurses are professionals who work together with other professional team members while fighting for higher education and continue to move the profession forward as those before us. These changes over time bring light to the constant need for change and continuous learning in the medical field. I believe knowing the nursing identity, who they have been, and what still holds true today. Nurses are still one of the most respected people today. We are still loyal to the patients, and we are still learning and advancing. This is our character, and our thinking is what pushes us forward. As a nurse, you must possess critical thinking skills and think about the bigger picture, and I believe this is what has moved nursing forward over the years. It is important to see how things have advanced through history, such as from Riverby's book, to today, to the future. History as evidence regards bearing witness and giving voice. It seems that over the years, nurses have wanted to provide safe and effective care, as through fighting for nursing rights, they are also fighting to provide that safe, effective care. Nurses have had and still have visions of improving the workforce, being involved in decision making, and having safer staffing. Witnesses over the years have shown the importance of educating and training for growth and knowledge. This empowers nurses for a greater profession, higher education, and broadening the nursing field. We continue to learn and improve through research and evidence-based practice. Nurses are also involved in influencing legal policy now. Seeing the evidence over the years of how nursing education and involvement has grown empowers us today to continue to fight for rights, health policy, technology growth, and patient safety. Nursing history in Riverby's book has accounts of what it was like to be a nurse then, what they went through, how they developed, to show us today how nursing has advanced and how we can continue advancing. The book also tells how nurses fought to be heard to improve their rights in patient care, which is true today, as many are involved in policy and politics to make our voice heard, and there are many that are trying to push the issue of safe staffing. History as explanation regards providing context, explaining the present, and looking forward to the future. Nursing went from having no detailed role and following orders as a soldier to having more definitive roles and even different specialties, as well as nurse practitioners. The expansion of specialties was called for due to the expansion of technology and more complicated diseases. It has changed the vision of caring and what that means from prevention to safe discharge. Today, we seek to empower nurses to practice to their full potential and scope of practice, including having input in patient care and care plans. We are also expanding in technology with the use of telehealth, This is more prevalent for doctors right now, but it is also opening up great possibilities in nursing as well. Who knows what the future holds?